We are in a country clearly where it's monkey see, monkey do. Dr. Risper, we have leaders who say follow the COVID-19 prevention protocols, but they are out there unmasked, walking in the crowds, shaking hands, and clearly flouting all these regulations. Talk about the impact of this.
So I think, again, even just going back to what people understand or how people receive information, when you see somebody in a position of power or position of leadership not doing as advised, you think that, oh, then this should be fine for me to do. And that's why it trickles down even to the way people are not accepting even vaccines, or people are, saying that, it's fine, or this corona is gone, because clearly we're all meeting in crowds and we're enjoying, we're coming up on election season. We're coming up on a time when we'll be in crowds. We're expecting people to be in crowds, or we're expecting people to be out and about. And this is the time we need to double down. This is the time we need to double down on our measures. This is the time we need to focus on making sure that people are safe. This is the time we need to actually even call out those people who are flouting the rules, as we did. We did it during the early stages of the pandemic. So now we've kind of relaxed. And I think we need to go back to that, because, again, who will suffer? The people will suffer. Those are the people who are going to be affected, because while, some of these people may have access to, some of the best care in the world, you have access to care based off of the radius or where you live, right? And that is influenced by how much is in your pocket. That is influenced by, how you grew up, that, so many things, right? And I think it's really critical for us to learn two really important lessons from this pandemic. The first one is that regardless of when we talk about economic growth and all these nice things, societies are made of people. People who drive economies, people who drive societies. And those people need good health care. They need access to care. They need access to, whether it's primary health care, secondary or tertiary care. They need to make sure they have access to care. So that means that actually health is an investment, and people need to stop looking at it as something that just drives away funds, that it's just something that swallows all the money. No, when you're actually investing in making sure a healthcare worker is at a station, you're making sure that, someone has access to not only good care, but they also have access to verifiable, reliable information about this pandemic or about any other disease or about any other way to make sure they can take care of themselves. So I think we need to really shift that mindset and make sure that we look at health as an investment, but we go back to also looking at how do we learn from this? Because what do we learn? As a country, do we say that we go back? Because that's the knee-jerk reaction. You want to go back to how things were because you miss it. It was good.
It's what you know.
It's what you know, exactly.
Yeah.
But I think if we don't look at health as an investment, and that investment, of course, we welcome the support from different external parties. That investment really needs to begin with us as the Kenyan people, but also the Kenyan government. You need to look at health as a critical pillar for your entire society to thrive, to survive, because we've seen what has happened when people didn't have access to basic services. It's not only COVID that people needed to go to hospital for. Women still needed to deliver babies. You still had to make sure people receive their, the antihypertensive medication.
Yes.
All of these things. These are still things that one system is supposed to do. And you have to make sure that the system can actually be resilient and adapt depending on what's happening in the prevailing circumstances. So, and that starts from our leaders, right?
Yes.
So going back to it, it's our leaders who really need to, follow the rules, because people look to them. Whether we want to say it or not, people still look up to our leaders, right? And they need to set an example in all aspects, including those investments, and being accountable for what they promise to do. And that's primarily taking care of the citizens.
Yeah. And yes, as reiterated by Dr. Risper, health is a right. So even as we talk about the right to health, there are some lessons that have been alluded to by the various speakers that have come out of this pandemic. When we come back,